Hello, families. My name is Sarah Glofcheskie, and I am BeMe CEO and co-founder. I'm here today with Dr. Sonya Doherty of the Natural Care Clinic. We're talking about the standard of care that is provided to autistic individuals and the massive unmet need in terms of getting to an actual individualized approach to care. That one that is no longer a one-size-fits-all approach, but one that is hyper-focused on that individual and their needs as they change. We need to look at the individual as a whole. So not just from a behavioral perspective, but medically, and we need to look at what's going on in the environment to understand all factors that are at play. Once we do that, we can connect the dots to make changes for our children. This is an approach that I followed with my daughter and actually worked with Dr. Doherty for several years and have seen a massive impact and a massive change in the quality of my daughter's life. This is something that I want to bring to other families with BeMe. So Dr. Doherty, if you could share a little bit more about your experience in utilizing this type of approach in your practice, we'd greatly appreciate it.
Thank you. So when I first started working with children diagnosed with autism, I didn't have my own children. I saw really overt medical concerns, things like insomnia, constipation, diarrhea, things that really, frankly, they should have been able to get care from their GP or their primary medical doctor. So what happened in those circumstances is that these things were labeled behavior. And so the first tenet of treating people diagnosed with autism is acceptance, but we can't accept the medical concerns that are co-occurring. And so the most incredible thing for me about working with BeMe is the ability to track information more quickly. So this accelerates how quickly we can identify what is going on in children's bodies. For example, I could spend 2 or 3 years trying to figure out why a child may have a certain behavior. But if we understand that behavior is largely driven by medical concerns or pain or discomfort, an app like this can track individual data for your child and come up with that information without having to wait and guess and try to figure things out when there's so many variables. So I'll give you just a really clear example. Aggressive behavior. It's very difficult for children, it's very difficult for their families and for people involved, educators and therapists. Aggressive behavior is often caused by noise sensitivity. Something like BeMe could track the noise and help families identify what could be triggering the behavior. Well, noise sensitivity is often related to constipation. If parents are tracking that data, they can link all of those things together. They can get treatment, they can get assessment, and they can get to the root of the behavior, increasing the child's quality of life and increasing their ability to have the opportunity to benefit from things like therapy and learn in an educational setting. So this is the beauty of BeMe. It's not guessing, it's individual data for a child, which has the ability to transform healthcare. Our families are not getting the support. If they can track the data, they can then go and get the right support. And this just changes the whole landscape of care.
Absolutely, couldn't agree more. Our children don't deserve to be in pain. They deserve medical treatment. It's a human right. And even if they present differently in terms of symptoms that are indicative of underlying issues, that's something that needs to be understood by our entire medical community. And so I saw that, powered with that approach, powered with reports that I could take to medical professionals, I was able to get diagnostics much faster. And we were able to get to, understanding the picture of what was underlying, health concerns with my daughter. So this is definitely something that we've had top of mind as we've built BeMe. We want to move as quickly as possible to be able to alert families and their care teams to the fact that there might be these other issues at play. So I know that you've started to use this with some patients and you're seeing good early results, and we want to get this to as many families as we can as quickly as possible. We're actually offering free licenses to families right now, and we'd like to help as many as we can as quickly as we can. So thank you again for joining me and sharing a little bit more about your approach. Is there anything else you'd like to share as we close off?
Well, the other thing that I learned working with families like you, Sarah, and kids like Flynn is that after we can tackle some of these medical concerns, what we realize is also transformative for the autistic population is that they're having a lot of difficulty controlling their body. They're having a lot of difficulty controlling their mouth and pointing. And this has nothing to do with their capacity to learn. So this is urgent from multiple fronts. One is quality of life, and the other is understanding that we need to really connect with people with autism in a way that is real and genuine, and keeps in mind that they're struggling to communicate with us, but they understand everything. And so this BeMe app, I also think, will transform the inclusion, like the inclusiveness that we need to work on with this community.
I couldn't agree more. And it is so important that we always presume competence in our children and understanding. And that's definitely been the case with my daughter. She understands everything that is said to her, but she hasn't always been able to show that understanding. Now she communicates with a letterboard. She writes poetry. She can do double-digit multiplication in her head. And so, we need to give children these possibilities to be able to thrive and flourish. And as I said, it is a human right. And so that's at the crux of our mission. So thank you.
That's a big one. And I feel very privileged to be involved.
Thank you so much. Thanks for joining me today, and we'll talk again soon for sure.
Yeah.